Nipple pain is one of the most common reasons why parents stop breastfeeding in the very first days. An effective latch is super helpful, and I'm here to help. I'm Erin Moore. I'm a pediatric nurse practitioner and certified lactation counselor and a mom of 2 boys. And I am going to show you how to get the deepest latch possible, which will help your baby effectively remove milk while protecting your nipples from damage. The first step to an effective latch is finding a position that's comfortable for you that brings your baby up to your body. So the goal is your baby coming to you versus you moving your body down to your baby. I personally like a pillow that is firm and kind of creates a shelf that your baby can get the stabilization on. So you might use cross cradle where your baby, this is Christopher, this is my son's doll, is across your body and your opposite hand supports your baby. Or a lot of times families like to use football hold where baby is on your side and then comes around top of your breast. Regardless of the position that you're using, the core principles are the same. So your baby's tummy should be on your tummy or chest. Their ear, their shoulder, and their hip should all be in a straight line. This helps your baby get the core support that they need because they just don't have a lot of core strength themselves. And then you are going to aim your nipple at their nose. So that means that your nipple should be aligned with their nose. So if you're doing cross cradle, it looks like this. Or if you're doing football, it's still their tummy is on your side. And then their little feet are wrapped around the back of your body. So you have your breast and you're holding it in a C shape around the breast. So you don't want it to be too close to the areola because then the baby will have a hard time latching onto the areola. So you want it to be back a little bit further. Then you're going to make sure you're supporting your baby's head. What I don't want you to do is you do something like this to support your baby's head. Because if you do that, babies can't move against the back of your hand because they just don't have a lot of neck strength. So instead of putting your hand right here to support your baby's head, I want you to move it down a little bit further so it's underneath the ears or at the base of the neck. That will help your baby move their head and have effective range of motion of their neck so they can open their mouth really wide like that, which is imperative to a deep latch. So you're shaping your breast, you're supporting your baby's head behind the base of their neck and not on the back of their head. Then you might have heard aiming the nipple at the nose. So instead of you going like this, so putting your nipple right into the baby's mouth, which gets them on just the tip of the nipple, we want your baby to open their mouth very, very wide. So we're aiming the nipple at the nose, baby opens their mouth very wide, and then comes on top of the nipple onto the areola. And really, truly, it is shoving with love. So I always think of it this way. When a baby's opening their mouth, we need to give them the kind of oomph to get them onto the breast. If you are eating a sandwich, let's say you have a big burger or a big sandwich and you're like, I want to take a bite of the entire thing. Well, if you just go in like this, then you're going to get a very, very small amount of it, right? That's fine. But if you want a bite of the entire burger at the same time, you really need to go into it with a lot of oomph and a lot of vigor. So what I like you to do is go like this. Ha. So it's the same premise when a baby is trying to latch. If you want them to get a very, very small amount of the nipple, it might still get the job done, but in an ideal world, we're getting them onto the areola, so onto the top part, by giving them a little bit of support. That is bringing them to your breast, so when their mouth opens really wide, we're bringing them up with a lot of vigor. That's the shove with love. So going, and that brings them to the breast and helps them bypass the nipple altogether, which will then let them remove milk effectively. So let's recap the step. Baby's tummy is to mom's tummy or mom's chest. The ear, the shoulder, and the hip are all in a straight line. Their little legs are curved around the body. You're shaping your breast a little bit further back from the areola, aiming the nipple at the nose, supporting around the neck and not like this. We're aiming the nipple at the nose, rubbing the nipple down from the nose to the lips, waiting for baby to move their head back and come along over the breast. And then we're gonna shove with love and then give them all the oomph that they need to get latched on. How do you know if a baby has a good latch or a bad latch? One, I want it to be comfortable every single time. There might be a little bit of like weird feelings once they start suckling because your nipples have to be elastic and sometimes that feels a little bit funny, but it should improve very quickly. If it's uncomfortable for a minute into the feed, even like 30 seconds to a minute into the feed, I would try to relatch. And what that looks like is breaking the seal. So putting your little finger along their gum line, breaking that seal, and then trying the steps over again. A good latch, what I like to see is that their nose and their chin are up toward the breast, that the cheeks are rounded, that they're not dimpled in. The mouth, the corner of the mouth, which is sometimes hard to see, is almost looking like it's in a straight line and it doesn't look like a triangle like that. If your baby is latched effectively, they should start to suckle and then they get into sort of a rhythmic pattern with eating. It should be comfortable for you and your baby should be able to get the milk that they need. If you are doing all the things right and your baby is still experiencing discomfort, this is when I want you to go and seek lactation care. Or if there's any indication that your baby is not getting enough, or if you just want some reassurance that your baby is transferring well, I highly recommend seeing a lactation professional, getting a weighted feed, getting any tips that they see, because sometimes we think we're doing everything and there could be some things that are improved. But I hope this helps your baby get as deep of a latch as possible. Make sure to hit subscribe so you can follow along for more judgment-free information.